Hello, everybody. Happy Monday. I'm your host, Darshana, and today is a very exciting day for me because we get to chat with none other than the Penny Simkins. She's the guru when it comes to childbirth and labor support, and she's been doing this since 1968. She has helped countless number of families. She has trained many people to do the same. She has written several books, not only for parents, but for professionals. And she has co-founded institutes that are training people to help people giving birth. She has also created a lot of resource around the much unspoken topic of childbirth trauma. And I'm so excited to get to chat with her today. So without further ado, Penny, how are you?
Oh, very well, thank you.
Thank you very much for being here today.
It's my pleasure, yeah.
So thank you very much for all the exciting work that you have done. And I was hoping maybe you can give us a little bit of how you got to do all the exciting things that you're doing and a little bit about your amazing journey so far.
Well, you know, it's interesting because I never set out to do any of this. There's a saying called "the way will open." And I had nothing to do with that. But I was an English major in college, and then I went on to physical therapy training. And then shortly after that, my husband and I had 4 children in rather rapid succession. And this was back in the 60s when you didn't work if you had children. And with 4 children, I don't know how I could have anyway. But I missed physical therapy. And so I found out that there was a Childbirth Education Association just getting started in my area. And I asked them, do you take physical therapists? I had visited England, and the physical therapists taught childbirth classes there. And so I asked about it, and they said they did. So I took the training, and that was really the beginning for me. I had no idea that it would become so important to me. I did it more for something to do, and it turned out to be my life's work. So getting started with teaching, I was focused completely on being an excellent teacher. But as I learned more, I began realizing that there were a lot of unknowns and a lot of inconsistencies, a lot of episiotomies being done, and then when I would try to read about it, I find that they weren't necessary, things like that. So I set on a mission to try to educate. At first I thought I'd educate obstetricians, and that was a little bit forward of me and not too successful. But I thought, well, I'll tell the parents about these things. And so that's what I did, and I was really quite rigid in the way I taught at first, but I've loosened up a lot over the years. I have always really enjoyed being around pregnant women and their families. I love babies, and I love birth. So it was a natural fit for me, and I had no aspiration to get into any other branch of physical therapy. The thing that I did do as I got into this, I had gone to a college that was very academic and it really encouraged research. And I began to realize that in the field of childbirth education, there was a shift, and they were going from education for childbirth more toward education for parenting. And they said, childbirth is one day in a person's life. They're going to be a parent for years and years and years. Why are we spending all this time on one day? And that did not sit well for me. I thought it is only one day, but it's a big day. Yeah. And I decided before I would switch over and focus on parenting education that I would contact students that I had previously in classes. And so I started in '68, but this study was being done in the late 70s. So they had been in my class 15 to 20 years previous, put it that way. Anyway, I sent notices out to all the people I could find, and I got a very good response, even though it had been 20 years since some of them had had their baby.
Oh, wow.
They were, I told them I wanted to find out what they remembered. And anyway, to make a long story short, I asked them to write the story as they now remember it. And I forgot to tell you that they had sent me a story right after their babies were born, and I've never thrown those away. I still have them.
Amazing.
And so I had that to check, and that was written when it was fresh in her mind. Mm-hmm. And then they'd send a recent one.
About how you had them write their stories originally, and then you had to rewrite them 20 years later, how they remembered, and you had actually preserved their original
Yeah,
stories.
yeah. So, yes, so so after I sent them a questionnaire that covered all the questions that had been in the first one. They sent it back, and I compared the two, what she said when it was fresh in her mind and what she said now. And the unbelievable thing was they were so close.
Ah,
After 15 to 20
20
years.
years later,
Yeah.
yeah.
And I checked to find out, did you write this in your baby book or something? And only 2 people had, and they only put a little paragraph in. So this was what they remembered.
Remembered, yeah.
And they remembered it vividly and clearly and with great emotion. And so after I compared the two, then I had them come in for a face-to-face interview. And we went over the two things. And so I was analyzing a little bit about satisfaction, how, as you look back, how satisfied you feel with your birth. And some of the people were very high satisfaction. In fact, most of them. I had 20 people that I had, and about 11 were very highly satisfied, and the rest weren't. So I talked to them more about that and discovered that there were certain elements that were associated with satisfaction. And I thought it would be the people who had wanted a natural birth and had it, or the people who had been afraid and were well cared for, that kind of thing. It turned out that some of the people that had had very normal births were not happy.
Oh.
And some of the people that had had cesareans, that they had, well, I only had one cesarean, but cesareans or a difficult birth, some of those were not unhappy. So I was surprised by that. And I discovered that it was how they were cared for that made all the difference.
Yes.
And, the nurse that was attentive, because we had no midwives, we had no doulas, and we had obstetricians who were very busy, and nurses. And the nurses who were concerned about the client, who took their comfort seriously, who were friendly and open, who made sure that their partners could come in. We didn't allow them to be there all the time, but they would bring the partners in as much as they could. They said nice things. I have quotes of things that they said that the women remembered years
wow,
later.
from 20 years ago,
What she said to me. And so that told me, this is more than one day in your life.
Yeah,
This
certainly.
is a memory that lasts a lifetime.
Yes.
And if we neglect that, and we didn't realize how important care was. Most people, we were fighting to get fathers or husbands, they had to be married, into the delivery room, and that was a big battle. But we didn't know that it was that it could be important to the woman's memory or sense of well-being. But anyway, that hit me over the head, and I started talking about that. And I've been talking about it ever since. When I train doulas, it's part of my talk always, that she's going to remember this for the rest of her life, so let's make it a good memory.
It's amazing how many things we take for granted now. So not having your partner in the room with you is something that we don't even think about it. And that's, thanks to all the hard work you guys have put in, that it's now a normal occurrence that the other parent gets to be in, or whoever you want gets to be in the room to support you. So it's really important to learn what a significant psychological and emotional impact that one day is having on that woman, as far as you said, 20 years out. So the question we ought to ask ourselves, what are some of the things that we can do to make this an empowering emotional experience so it shapes the future positively for that birthing person?
Yeah, and that's that's key. And so many people, even today, go into it without knowledge, and not knowing what to expect. Maybe they've learned from watching TV or their best friend or something, and often they don't really know what their role is or how they could help themselves. So this is what I would really like them to have is certainly education, childbirth education, and that isn't terribly popular now. It seems like people are going to classes less now than they used to. And I think it's busy lives and things like that. And also everyone says, well, I'm just going to have an epidural, so I don't have to know anything. And they do. But I have a little list here. I think they need to know that there are some choices available. You don't have to do exactly what is what the doctor says or what the hospital usually does, if they knew that there were some choices, they would probably choose a little differently from routine care.
Mm-hmm.
And then the other thing is having support. And in today's world, I believe that the partner has a unique role to play, and I encourage them to be there. But I also realize that with all the high tech and the busyness, it can be almost overwhelming for the partner. So we want the partners to be educated, but we've also started training doulas, and these are usually women, but not always, who are trained and experienced in childbirth, and then they'll be there with the couple. And can guide the partner, reminding him of this. Remember how you learned the double hip squeeze in class and things like that. And it helps them do their job better. And they also can, sometimes it takes more than one person to help a person through contractions. If she's having back pain and needs help maintaining a rhythm or whatever in her breathing, it's got to have someone in the front and the back. So I was one of the founders of the doula movement, and I think that was one of the best things I've ever done. We never find anything wrong with doulas when they're
Yes.
doing the role as it's been laid out. So I would just say education, support, know the choices, and have and choose a caregiver that is open to your choices.
And I mean, yes, education is power. The more you know, the more you can decide. But also, I've read so much literature that shows that whenever there's constant one-on-one support, also known as doula, birth outcomes are so much better. So yes, thank you. And I think you're right about people are just getting too busy to have any childbirth education class. It just seems as though there is so much going on in lives that before you know, the day arrives and you forgot to register for a childbirth education class. So thank you for kind of reinforcing the importance of knowing what your choices are. I wanted to go into like some of the common questions that I get from my patients in terms of movements, in terms of what can they do to get the baby in the right position, because everything is going great until somebody tells them the baby's not facing head down and people start to panic. So are there any kind of clinical pearls that you would want to share in terms of that emphasize importance of movement or that facilitate the baby's position inside the belly to kind of help things along?
Well, yeah, there are. The one thing that I do have to say is that sometimes when a baby is in the wrong position at the onset of labor, and maybe its head turned the wrong way, the least favorable way, that virtually all those babies do rotate. Babies do move around in labor, and a very important study was done in Boston, and they found that most of the babies that were in the wrong position at the end of the labor had been in the right position at the onset of labor. And they had turned into the opposite posterior position. And the opposite is true. Some of the babies in the wrong position will flip. And so when I say wrong, I just mean less favorable.
Correct.
So I don't want to place a big load on the pregnant person's conscience. Well, if you had done more of this, your baby would not have been in the wrong position. I don't want to play that game, but so there's that, and so I don't want people to think that if I had only done this, it would be better. But I think taking it as it comes, but knowing. I mean, I'd like people to be active. I'd like them to do squatting practice and lunging practice and things that will limber them up as long as they don't have pain when they do it. But the other thing is that if during the thing that I think people need to know about their own bodies is that pregnant people have a pelvis that's very different from a non-pregnant person. The ligaments that hold the bones together are very tight when we're not pregnant, but during pregnancy, the hormonal changes make them a little more stretchy and make it possible for the pelvis to open more, or for one side of the pelvis to open more, and to put pressure here and not there. There are many things that people can, and you could teach them all that stuff, of course. But knowing that the body is more ready is better at making making it possible for the baby to turn than it would be if I were going into labor or her partner was going into labor with a rigid pelvis that wouldn't give a bit. So she could know that some of these movements that we learn, stair climbing, lunging, hands and knees positions, many of those, all of them change gravity. They can change the shape of the pelvis and often relieve tension or back pain or other kinds of pain. So I think people should kind of plan on playing an active role in labor, and often seeking comfort. Sometimes they know they're more comfortable if they're in this position than this position, and often the comfort is a good sign that things are going well. Okay. So I don't know if that answers your question.
It does. So it sounds like, in summary, you have to trust your body to do the things because it is designed for it, especially because your body knows you're birthing, so it prepares for it. Mm-hmm. And second is, what I gather is, listen to your body. If something feels good, there is a reason why it feels good, and sort of keep trying to find what is that something that feels good. And I really, really appreciate your wisdom in the sense of, I feel like women often, in the hindsight, only if I had done that, or only if I had done this. So thank you for saying those kind words, that we don't need to put one more thing on the pregnant person's head that they're responsible for, because babies keep moving. It's not like you slept wrong and the baby didn't get in the right position. So thank you for that gentle reminder. And I have one last question, Penny, because I feel like this is a concept that is not understood by many. Birth is usually wonderful and it's amazing and it's a day you fondly remember, and yet there is trauma for some of us giving birth, and often people have not heard the word birth and trauma used together. So for those of us out there who have not heard this word, would you mind just kind of briefly saying what is birth trauma? What are we looking for, and how can we kind of know that has happened to someone?
Well, I think birth trauma is having had an experience during the labor that was either unexpectedly painful or unexpectedly abnormal, requiring surgery that was not planned, or sudden movements, or maybe the mother's blood pressure goes up and everything has to change. I mean, so sometimes events that are unpredictable do take place during labor, and that's why I think having some flexibility and that's why we go to professionals to help us have birth, is because they're good at helping us with the things that can go wrong. But and that's a small portion. A person who is in good health going into labor is not. She's not likely to have a terrible experience. The place, though, that birth trauma is often neglected is when a person is treated badly during labor, disrespectfully. And right now, I think the biggest movement in childbirth around the world is disrespectful care and eliminating that. And that happens in the richest hospitals with the best machinery, and all the way to midwives who are working out in rural areas or jungle areas. And often the woman is not treated kindly. And that is very damaging, because no one is, I think there are very few circumstances when an ordinary person is more vulnerable than during labor, and dependent. And if people are, we hear about some places in the world where women are slapped during labor or shouted at. Luckily, that isn't likely to be happening where I live and in my country, but we do hear that kind of story. But we also hear of people that are embarrassing the person. Like, you don't have to be a hero, you can take you can go to sleep and have your baby, or kind of making her wishes seem unimportant when they're her goals.
That's what she wants. Yeah.
And then afterwards, she may think, gosh, they didn't help me at all, or and unkind things are often said, and that and I have. In my study, I have quotes of things that were said to people during labor that were hurtful and had them lose confidence. And then actions like sending the partner out and not letting him come back in, just forgetting all about him.
Oh,
And so the woman's laboring alone, wondering where he is.
oh,
And even people that are free of pain, even if they've had an epidural where they feel nothing from about the breasts all down into the legs, you'd think, well, gosh, if she doesn't have any pain, how can she be hurt in any way? But to say negative things to her, to be judgmental, um, to imply that she's doing a bad job, that kind of thing lives with a person for a long, long time. And that's the kind of trauma that it doesn't heal. It doesn't heal like an injury might,
yeah,
Uh,
yeah. I hear
and
you.
yeah, and so I actually have spent an awful lot of my career. I have no credentials as a psychotherapist or anything of that nature, but I feel so strongly about how vulnerable people are to negative criticism that I really like to have them come and see me, and we talk about it and we reconstruct it, and I can help her see that maybe that was unreasonable. And when you think about it this way, do you see how you were really a hero or something like that?
Yeah,
And often people are so relieved to hear that they weren't such a problem, that they didn't do a bad job or whatever.
yeah.
But it
'Cause
can
you're,
affect the way you mother your baby, and your relationship with your partner if you feel badly about yourself.
yeah, I mean, how you
Those
feel
kind of
about
things.
yourself essentially translates or trickles down into everything, right? And as you said,
Yeah.
most people have been the most vulnerable. And forget about childbirth. Like when you're butt naked in front of 10 people, you're already
Yeah.
feeling vulnerable, and then you're in the worst pain of your life. So all in all, I can totally see how what is said or done, not really said. Sometimes it's the passive things that happen, not so much the word that leave kind of like a visceral impact on that person,
Mhm.
so thank you for sharing that. And I think the listeners will have a better understanding of birth trauma, because often once there is a happy healthy baby on the other end, people forget what happened to the
Yeah.
birthing
Yeah.
person and they
Yeah.
just feel so invisible and almost guilty about complaining, because the messages they get after, well, look at your baby, it's all worth it.
Yeah. Yeah.
It is, the baby is everything, but
Or
also it's
why didn't
important.
you do this? Why didn't you do that? So you
Yeah.
can make someone miserable.
Yeah, and those hormones don't help when you're
Yeah.
thinking.
Yeah.
All right, thank you, Penny. So we are going on to the fun part of this series now.
Oh, I hope
Um,
this is fun.
it's called The One Thing. So a little bit about it for our listeners is most answers in health are comprehensive. And I want everybody listening in to just take this as the fun part. This is not clinical advice. This is not anybody's opinion. But what this segment is the one thing. You know how often I get asked, what's the one thing I can do to do this? And we all know the answers are never as simple as the one thing. But that's why this segment, to kind of help prioritize what are some of the things to know. So I have a few popular questions that I always get asked, and I was hoping that we can use that for you in the one thing. Okay, are you okay with that,
I'll
Penny?
give it a try. I'll give
All
it a
right,
try.
thank you so much. So, what is the one thing I should include in my birth plan?
I think probably the most important thing is, well, two things I have to say, but an attitude of flexibility and appreciation to the staff. If they feel that you are on their side or you appreciate what they're doing, they will be kinder. And that may be more important than the actual choices that you put in the birth.
Yes, very truly said. What's the one thing you want a person in first stage of labor to know or do or be mindful of?
I want them to know how to time their contractions so that they can get to the hospital at the right time, not too early, not too late.
Great. What's the one thing for second stage of labor?
For second stage, I would want them to know to push when they feel an urge to push, and that they don't have to hold their breath, for a long, long time, but pushing according to what their body is telling them, not what some uh, caregiver is telling them.
Yeah. And what's the one thing for the mom to look out for herself in the third stage? Because most mothers are, enjoying their babies on them, hopefully. But the mother, what's happening with her? What's the one thing that she should watch out for?
Oh, I was going to say have the baby skin to skin, but
There you go.
it sounds like you had that
And that's still the one thing that they can do for the third stage. And as I said, hopefully all mothers are having their little ones on them and enjoying that time. But I was wondering more of like, is there anything to know or to watch for as far as the placenta, the post, delivery things? Is there one thing that they need to know? Because for good or for bad, most people don't remember what happened after the baby came out. But is there something that comes to mind?
Well, knowing that you're not done. And so you may have to push a little bit, and there may be some discomfort with the contractions in the third stage. So you're not done.
You are right. You're not done just yet, because that's exactly how I felt. I was like, my baby's on my chest. Leave me alone. I'm done. And suddenly I realized, no, you're not.
Yeah. Okay.
What's the one thing for the birth partner, the dad, the mom, the person who's supporting, whoever is there, kind of holding the fort down for the birthing person? What's the one thing for them to know?
The one thing is to know that rhythm is a sign that the person is coping well. So if the laboring person has a rhythm to breathing, her voice, her movements, even slapping her partner, if it's in rhythm, even if the sounds are weird, if that person has a rhythm in whatever she's doing, she is coping. And so people should not try to correct her or anything, but to support that.
Yeah, that's huge.
Rhythm
Thank
is
you.
everything.
Yeah, thank you for saying that, because I feel like a lot of times when people hear the word coping, they associate that with the person not in any discomfort. But as you said, like, coping can look different. And if you pick a rhythm that, even though they look like they're in pain, as long as they have rhythm, they're coping. The next question is, one piece of advice for somebody who's considering or wanting or wishing a VBAC.
The best thing you can do is to have a care provider who is supportive. And that's not always easy. But if there's one who has doubts about it or resents having to wait for labor to start, the odds are much lower that she'll have that VBAC.
Yeah, you need a team that is supporting that.
Exactly.
And last question, and we kind of sort of covered it at length, but what is the one thing when it comes to language? So as a person who's around a pregnant person, as a society, as a clinician, if I'm around a pregnant person, we learn that language can have a long-lasting impact on that person than we realize. So is there something that comes to mind as far as the language we use to do or not to do, just to not make the experience a bad one for that person? And not necessarily during birth, even during pregnancy.
Well, I was actually thinking of something during birth.
Sure.
But the thing that so often during labor, when it's very intense, the woman may say, I can't do this, I can't do this. And the partner or the doula or the care provider says, you are doing it. And that does not help. Don't say that. You're saying you're wrong. You can do it, and you are doing it. And so rather than arguing with her or telling her that what she said is wrong, say, this is hard, and you're doing very well, and let me help you more, and let's keep that rhythm, or whatever. But to tell her that what she's feeling is wrong or what she's saying is wrong, at that time, she just gives up and says, they don't get it. They don't understand.
Yeah.
So if someone says, I can't do it, I would never say you are doing it. I'd say this is hard. And let me help you more. Let's see if we can get through it this way or whatever. So acknowledging the importance of that message. Okay,
that's excellent. That was all of my questions for the rapid fire. This was so much fun, Penny. As I said, this is like a dream come true for me. I have read your books. I have quoted your articles in my case studies, and I never thought I'd be talking to you. So thank you so much.
And I have to tell you that you were very helpful in our class. We had to shift to Zoom in the middle of the series, but you had wonderful things to say.
Thank you so much. The pleasure was all mine, and I just wanted to thank you on behalf of the entire PT community, if you will, because you're such a trailblazer, and I'm just very grateful that this path that I'm walking was created, and I didn't have to create one, because I don't think I would have been able to. So thank you.
You would have been able to. You're a go-getter.
You're so kind, Penny. And the other thing I wanted to thank you for is the kindness, because I have been fortunate to cross paths with many professionals who have worked with you or learned with you, or patients who've taken your classes, and the one thing everybody says is you're just so kind. And I have
Mm,
experienced that firsthand in just your language. It's just so kind that
mm.
whatever you say just feels nice. It's so thank you for
Oh,
being such a kind voice. And that voice can be grounding in many ways. So hopefully one day I will become a clinician with that kind word and kind choices of
I
words.
I hope so, and I hope you don't leave Seattle. We want you here.
Ooh, me too. We'll see how that goes. But
Yeah.
thank you again, Penny. This was
Okay.
wonderful, and hopefully we'll do this sometime again.
Thank you very much.
All right. Have a wonderful rest of the day. Bye
Yes.
bye.
Thank you. Bye.